Hello, this is Dr. Evelyn Hill with Shades in Justice podcast. Hey, we're so excited you decided to stop by. Hey, you can catch us every Wednesday evening, 8:30 Central Standard Time or 9:30 Eastern Time. We want to see you right here at Positive Power Christian Radio. Again, this is Dr. Evelyn Hill with Shades and Justice podcast, a chance where you can hear about justice and injustices here in our country. Again, Dr. Evelyn Hill with Shades in Justice podcast. Hello and welcome to Shades in Justice podcast. I'm your host, Dr. Evelyn Hill, and we are so excited you decided to stop by on today. You can always reach me at www.drevelynhill.net. Well, we've got a wonderful, wonderful lineup on tonight. We have one of Kansas City's finest, the one and only Miss Shannell DuPree, and I'm going to kind of quiet myself down here. I'm super excited she's with us on today, but I'm going to let her share a little bit about what she does here in Wyandotte County, Kansas City, Kansas now, and then we have a variety of other things we're going to be talking about as she introduces herself. Miss Shannell DuPree, welcome.
Oh, thank you. Thank you, Dr. Hill, and just thank you for the opportunity to share space with you. I always enjoy our conversations. I'm, as you stated, Shannell DuPree, and I would define myself as a connector. And however, the string that connects my entire life is my faith. And so that is the basis upon which I operate and I do things. I'm currently the regional director for the Kansas Department for Children and Families. And we cover Wyandotte, Atchison, Leavenworth, Douglas, and Johnson counties. And I'm also the executive director for the Racial Equity Collaborative, which works to bring people together to really address why Black and Brown children are in the foster care system at a disproportionately higher rate. And my husband and I are in ministry here in Wyandotte County, and he is the pastor at a church in our community. And so we are raising our 4 children here and doing all the things that parents do and rearranging schedules and just showing up and all the things. But it's a pleasure to be here today.
Well, the pleasure is really all mine, and thank you for taking time out of your super busy schedule to be with us on this evening. And I just want to get right into some of the things that we discussed that you might be sharing on this evening. First of all, just how were you selected or appointed to your position as regional director?
Yeah, so I will share that, but what I will also share is that my journey, my career journey has been full of interesting moments.
I love it.
Yeah, I graduated law school and I used to put on my resume, I'm full of passion. Like I was ready. I wanted to just help. I wanted to dive in there, but I had no experience. And it was during the Great Recession. So when I graduated law school, people weren't hiring new lawyers. They wanted a sure bet. They wanted people who had kind of been in the industry, and the work that I wanted to do. I knew I wanted to work in social services and family law, that those sectors just weren't hiring at all. And so I had to pivot. I had to do things that I didn't necessarily want to do, but I needed to work and just use my brain. For a day, I said, you know what, I'm just not going to work. I'm going to stop. And I went and I found that I really like shopping. And so I discovered at the end of the day, I need a job. Okay. I can't just not go to work. So that lasted a day.
Uh-huh.
But so it's been filled with many different experiences. I started with the state actually, as my kind of official grown-up job, the Kansas Health Policy Authority, and I was with them for a little over 2.5 years. And I don't know if you've ever experienced like finding out that you would no longer have a job in a very public way. But I was watching the state of the state address, and our governor at that time was giving the state of the state, and he said, and we're going to be abolishing an agency, and he named the agency that I was working at. And so that's how I found out that the agency that I was working at was no longer going to be in existence.
Wow. Oh my.
So I needed to make a career change,
Yes.
but was very happy with the work that we did. We helped to create the help. There were many organizations, but was a primary proponent of um, the statewide smoking ban and
Mhm.
and things of that sort. And so I started working with my law school as a diversity professional. So doing that type of work, and then ultimately, I really wanted to be in the courtroom and work with families. And so I just kind of launched out there, opened up my own law practice, had no idea what I was doing, but took it one step at a time. Didn't even know where to stand in court. It was something, but I took one case and I did really well on each case, and so it just grew, and God just blessed it and breathed on it, and I started with one and ended with hundreds of cases when I ultimately stepped away, 9 years later. And then my husband was elected as the first African American district attorney in Wyandotte County, and we had four small children, and I needed to not be in the courtroom as often as I was. I needed to be more available for our children, and so I didn't know what I was going to do, but I decided that I still wanted to talk about child welfare, and so I started interviewing people around the state. And one of those interviews was our now governor, Laura Kelly. And we sat down and just had a really great conversation for an hour. And at the end of the interview, she said, I think I'm going to be seeing you. And I said, okay. Now, she wasn't the governor yet. She was running for
Uh-huh.
office, and she ultimately won. And then I was asked to be a part of her transition team. And then a couple months later, I was offered the position. So that's how I came into my role as the regional director of the Kansas City
Oh
region.
my, that's phenomenal. I think uh, one of the themes that you mentioned regularly during our conversation already this evening is you don't mind stepping out on faith. You said you stepped out there not knowing what you were going to do. You didn't even know where to stand in the courtroom, but that's pretty amazing that you have that kind of a faith walk, because oftentimes people want everything just handed to them on a silver platter
Yeah.
without doing any kind of stepping out on faith at all. And so to hear you just jump out there is pretty amazing. So thank you for sharing that. And evidently,
Yeah.
that conversation you had with the now governor,
Yeah.
uh,
It went well.
it was a pretty powerful. I needed to been a fly on the wall or something so I could have heard
Yeah,
that. Yeah, that was remarkable also. So thank you for sharing that. And now
absolutely.
let's get into your role there. Kind of uh, what are you doing? I know you're the executive director over the racial and equity piece. And how does that work? How has that affected what you do regionally? Um, and then we'll just go from there.
Yeah, so my role at the Kansas Department for Children and Families is I would kind of describe it as like a hospital administrator. I accept it's social services,
Yeah.
and it's not just child welfare, it's adult protection services, it's vocational rehabilitation services, it's food assistance, it's cash assistance, it's all of those things. And so there's a lot of federal programs that we're responsible for. And there's a lot of communication that has to happen. Our region has about over 500 employees. And so I am responsible for ensuring that all these programs and practices are implemented. Something that has happened in since 2019, since Governor Kelly took office, is there has been a concentrated approach on prevention. Like, how can we help families before they get to a point of like
Mhm.
extreme crisis? And
Right.
so there
Right.
was federal funding that came down that really helped with that. But you can have the money, but if you don't have the implementation, if you don't have the buy-in, like you
Hmm.
can't just tell people, okay, change what you've been doing for 20 years.
Right.
It's a whole process. And
Hmm.
so
Hmm.
through that process, though, we've implemented the Kansas practice model, which really changes how we work with families. We've been able to reduce the number of children in care to like record level lows. So
Hmm.
now it's at about 5,999 children, whereas, in 2018, 2017, 2016, we were teetering at, 7, 8,000 kids in care. And
Okay.
so the number of reduction has been amazing,
Hmm.
and we're safely keeping families together.
Hmm.
So when I was in the courtroom, I felt that families of color had worse outcomes. But
Hmm.
then when I actually got into the agency, I saw the data. And what the
Hmm.
data shows is that children of color, specifically Black children, Native children, not necessarily Hispanic children in Kansas, but definitely like in Texas and in California. But those children are going into care at a higher rate than they're in the population. They're staying in care longer. They move more often. They're aging out of the foster care system, which has its own negative impacts. Children who age out without connections are more likely to end up incarcerated, early pregnancy, all of the homeless, like all of the
Hmm.
outcomes that we don't want. That's usually what happens to children who age out without connections because connections
Hmm.
are everything. So it was through a coffee conversation with a friend in 2021, and we were just like, what can we do? And I've been having the conversation regarding like racial disparities and inequities, but there wasn't like a statewide conversation committed to discussing it regarding social services. And so
Hmm.
she was with Care Portal, which is a faith-based organization that provides care resources for children and parents. And we also connected with the University of Kansas, and ultimately we started having these online learning lectures and
Hmm.
a symposium, and it just grew. And we've now touched, over 3, 4, 5,000 individuals who have been a part of the journey. We have in-person symposiums. We bring in, national speakers. We present about poverty, neglect, all these different things. And it just came to a point where it made sense to make it its own nonprofit,
Hmm.
501c3. And so
Hmm.
that's new. So that happened this year. And
Congratulations.
thank you. Thank you. And so I was asked to fill the role of executive director. And right now I'm coexisting as regional director for the Kansas Department for Children and Families. The agency is supportive, and also the executive director for the Racial Equity Collaborative. So that's what's happening right now.
So what you're saying is you really need a clone. That's what you're saying. And you need about three or four of them because this you need
Oh,
one for the family, one for the church,
oh
one
my
for the
goodness.
state. And
Oh my goodness.
so you need at least four of you.
That
Well,
would be
hey,
amazing.
I want you to know we definitely applaud you for uh, the work that you do. The passion is evident for someone to take on that role. The regional role sounds for lack of a better word, like it's sexy, it's all that in a bag of chips, but in reality, it's hard work. And how do you get all those systems connected where they really do impact and help families with wraparound services available in the community? So I understand it's not as cute as it sounds.
No,
And then
ma'am.
the executive director role, um, as you uh, cross into communities across the country, because I've been to several of the symposiums online. Oh my gosh. And the information, I finally made myself delete. I took pictures of all the PowerPoints and everything. I'm going, Evelyn, you don't have that kind of memory on your phone, but the information was just incredible. It was
Thank you.
incredible. And the last symposium, I think, that you had here in KCK was at the community college.
It was.
And that's where I really learned a lot. I was so impressed. You had an individual from DC who I think was a part of President Biden's staff. Am I correct?
Yes, that is correct. Associate Commissioner Schomburg. So she's the
Yes.
director, she's the lead for the Children's Bureau. So, yes.
Incredible because we don't often hear of individuals coming to our part of the uh, I'll say our part of the city. We have a big metro area, but to
Yep.
come into Wyandotte County, that was huge to me. And but it didn't stop there. You had several representatives from the state, and all of them had really good information. They really challenged us to think differently. We always think about somebody else doing the work instead of we ourselves accepting some of the kids and training and housing some of the kids ourselves. So it was an incredible time for me and a great opportunity to learn. So thank you for that. So another thing I wanted to ask you is when you started this work with the strong focus on racial and equity disparities in foster care system, what were some of your main challenges? Was it that systems approach that was hard? I don't know. What were some of your challenges?
Well, I think that it was kind of an internal challenge. Like
Okay.
it was a, are you really about to dive into this? Because this work can be very, um, what is the word? It's just, it can be a lot
Hmm.
because sometimes you don't see the change. Like it's
Hmm.
not rapid change, it's very
Right.
incremental
Right.
change.
Hmm.
And so it's like you have to find ways to celebrate the successes
Hmm.
or you'll get discouraged. And so
Yes.
it was, how can I not just do the work, but bring people along in this
Hmm.
journey because I can't
Hmm.
do it by myself.
Right.
And
Right.
that was the thing for me. Like if this is going to be work that only Shannell is going to be doing, it's not going to happen. Like we need to be doing this together. That's why organizations that hire, a DEI officer and just expect for that one person to change an entire organization, they're setting
Right.
them up for failure. It doesn't
Exactly.
work like
Yes.
that. And they're setting them
Right.
up to be burnt out because
Hmm.
they don't have that support. And so, DEI efforts have to be integrated into the policy, into the procedures, into the practices, into the questions that are asked on a very consistent basis. And so, like once I decided that I was going to use the position that I had to advocate for that change,
Hmm.
then it was like, okay, let's go. But
Hmm.
it was a decision, like a conscientious decision that had to be made.
12.5 cents. Hmm. Wow.
Yeah.
So that is uh, amazing, and the reason I asked about that is that I knew it was not easy then. It's still not easy, and how have you weathered that storm? And you partially answered that. It's because it's not just about you. Systemic changes are tough.
Yes.
People fight to hold on to systems that don't work.
Yes.
And so
Because
when
they're
in the,
comfortable.
who are you? You're this little young whippersnapper coming in telling us to change the system. No. So
Yeah.
we're going to fight against you, make sure we do everything we can to make you uncomfortable, to make you quit. But
Yeah.
I'm grateful for the sake of the kids in our state that you continue the work.
I will say that my agency, so DCF, and especially my direct supervisor and then the secretary, have been so supportive. And
Mm-hmm.
that has, I think that's allowed us to go further faster,
Mm-hmm.
just with that support. And so, because of that, kind of, it's coming from leadership that this is how we're moving, this is how we're functioning. Even if folks don't want to move, there's an
Mm-hmm.
expectation that people are going to engage in this conversation, and so that is happening. So
Mm-hmm.
that's a good thing.
And you don't hog the show. And what I mean by that is, I watched in the meetings that I've been in, and especially when you had the conference here at the college, you could have done um, a whole lot more to promote yourself, to do most of the program yourself, but you didn't. You shared it with your staff, you shared it with folks around the country, and then you encouraged the audience to get involved. So I really applaud you for that, and you don't have to pay me anything for keeping continuing to applaud you, but I just want you to know I've seen other um, executive directors, regional directors in positions that are not near as engaging as far as teamwork. You seem to thrive with encouraging others to come on board versus hogging the show just for yourself. So that was exciting to me also, and so to me, it's really necessary.
Thank you.
Like
Well,
you
that's how the
said,
work, yeah, it's how the work
yes,
lives on.
yeah,
Yeah.
yeah,
Thank you. Appreciate
yeah.
that.
So I know you don't have to send a check today. You know,
Put it in the chat. Put it in the chat.
exactly. So another thing I wanted to talk about, what were some of the key hindrances that you ran across as you have built this work? You've been doing this work now for how long?
So, are we talking about just working with families, or because that's coming up on some decades. But my
Well,
role within
the
DCF has been
yes,
5 years.
yes,
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 5 years. 5 years.
5 years. Okay. So
Yeah.
what have been some of the hindrances?
Well, I think that I was kind of an outsider coming in. So although I had worked for the state, it was very early in my career, and I spent, a decade in the courtroom as an attorney, and now I'm in this role where I'm not functioning as an attorney, and I'm working in social services. And typically, the dynamic in child welfare is there's not like a there's not necessarily a collegial relationship between the lawyers and the workers who are doing the case. And so now that wasn't necessarily my case because I understood their role, but a lot
Mhm,
of people who are working in the system don't understand one another's role. And so then what
mhm,
happens is they demonize the other person
mhm,
for what they're doing. And so for me, it was kind of coming in, having practiced by myself along with my husband, but us practicing now, it's a organization with over 500 people that I'm responsible for managing and listening to and being responsive to. I mean, so that was external and internal. I'm an outsider. I'm coming in. I have these ideas. I
Yes.
have a different kind of philosophy and way that I work with people. I'm not doing the whole, there was a lot of kind of people not trusting that they could really share what they were really thinking and
Uh-huh.
that they would be retaliated against. And I'm
Right.
like, I'm not doing that. Like I'm going to be clear and honest with you. There's not going to be
Mhm.
like the underhanded, just what's working, what's not working, all the things. And so it was building that trust
Uh-huh.
that I am going to do what I say I'm going to do. You get what you get, and I really do want to hear your thoughts, and that's going to
Mhm.
be a part of like how I manage. So
Mhm.
I think that was kind of the biggest transition that I had coming into like social services and management.
Mhm. One of the things I've noticed just over the years is that we often have to recreate ourselves over and over again. You mentioned you realized you like shopping, so you had to work, and you went from being an attorney, and now you're not an attorney, but you work with the attorneys, and so
Hmm.
over and over again, we find ourselves. We have to recreate and rebuild, and but the good thing is that we have the Lord who really helps us along the way and
Yeah.
gives us the strength to be able to make those transitions and to make them successfully. Uh,
Yeah, but
yeah.
I will say, it's I love that you called that out. But it was hard. Like I was so used to like I identified as being a lawyer. Like that's
Yes.
what I had done. That's what I went
Mhm.
to school for. That's what I enjoyed doing. So when I needed to do something different, I remember it was such a struggle and I didn't know like where I fit. And
Mhm.
so I remember, having a conversation with God. I was frustrated. I'm like, it feels like
Mhm.
I built this from
Yes.
nothing and now I have
Mhm.
to start over again. And I told God, I said, I'm tired of having to create it. I remember that conversation. And he said, who are you? Like, are you, if you're not a lawyer, right? Is that will you still serve me? Right? If
Uh-huh.
this isn't the path that I'm going to have you on, are you going to be okay? And I
Uh-huh.
had to just say, you know what, Lord, not my will, but your will be done. Like that's how we have our conversations at times. And then, just to look back, I'm so glad that that transition happened. I'm so glad that I'm in the space that I'm in. I'm so glad that I'm kind of rediscovering other strengths, and that I decided that my identity is not a lawyer. That's something that I've done, that I do, but that's not who I am. That's not who
Mhm.
God created me to be. So,
Mhm. That is awesome. And I think this conversation should help a lot of women, especially who find themselves uh, starting over and don't really want to start over. When do you just get to relax and sip tea and just, put your
go
feet up?
shopping.
Yeah. Why am I recreating myself
Yeah,
again? So
yeah,
I love that fact that you were able to talk to the Lord and say, I really don't want to do this, but nevertheless, not my will, yours be done. So that is, it's so relevant. And, you know, the job market is changing, even how we communicate. Uh, it used to be you could always count on folks to email you or email you back, not necessarily anymore. You could always depend on folks returning your call, not necessarily
mhm,
anymore. And now,
mhm,
even text, you may not hear from folks even coming back with text. So, if you go and apply for a job, you may hear from that agency, you may not. And
yeah,
they you don't answer phone, they don't do
yep,
it's tough. It is really tough. So you have to be able to sit and wait on them or go out and find another way. So
oh yeah,
I
oh yeah,
appreciate you sharing that. I really
absolutely,
appreciate you sharing that. And so I believe more people are transitioning than um, what we know about, and
Mhm.
just to know that we can depend on the grace of God to help us through it. It means a lot. So here is one of my last questions.
Mhm.
Um, what are you doing for 2024 as you move forward? What's some of your planning for moving forward? And then the second part to that is, what can we do here in the community to help you and your organizations? I'm putting the S on it.
Right. Well, so, for 2024, I mentioned earlier, my husband and I are um, a part of our ministry, Grace Tabernacle, and so that's just an important piece in our life, and so that's something that just building the ministry and just continuing to, I feel like that's our ground level work. Like that's where you don't see it, but it's where we're working with families, we're encouraging families, we're sharing God's word, we're walking with families through loss, through joyous times, through all of those things, and just building a community of faith. And so the church is always something that is will always be important in our lives.
Mhm.
Regarding the Racial Equity Collaborative, we were recently awarded a grant, a federal grant, as a subawardee, and it's the first of its kind. The Children's Bureau issued a grant, put a call out, and there were 8 organizations selected across the nation, and we're a sub awardee under the University of Kansas, but it's addressing racial disparities in child welfare. And so it's exactly
Wow.
the what we've been
Yes,
talking about.
yes,
So, what people can expect is you're going to be hearing more about that federal grant. We
yes.
want to bring in organizations. We want to bring in people who have lived expertise, who have been a part of the child welfare system, specifically Black and Brown families. Youth who have been a part of the system, because this grant is different in that that's how it's going to be built. That's how our priorities and how we're going to kind of implement change. We need to hear the voices of the people who have been directly impacted. And so that will be the major focus into 2024. It's called Kansas Brave. And we're
Mm.
um, uh, bravely activating voices or something. I don't know.
I
So, but
like it. I
very,
like it.
yeah, very excited for that. And, just with the department, we're just really focused on, staff safety, employee morale, having a stable workforce. That's a thing.
Hmm. Hmm.
It's important for the services that we're providing that people would receive like a continuity of care. And so there's just many facets and many things that go into what we do. But I'm just grateful for the opportunity to do what I love to do.
Hmm. Well, this has been incredible podcast, radio show, because seldom do I have folks on here that um, have had a conversation with the governor before they were governors, stuff like that. I just so this is pretty amazing. I also want to make a couple of comments. Number one, I visited you all's church. I absolutely love it. The word of God is solid. That comes from both you and your husband, and also the love and to be able to feel the spirit of the Lord in the place is it's amazing. The praise and worship is good. The word is good. It is just I call you all the dynamic duo.
Oh, thank
Because
you.
I've seen you all working together in such a phenomenal way, and where you could get the big head, I think the church just kind of levels
Oh, yeah.
things out to where you're able to be, at ground level with individuals right here in the community. So I wanted to just comment on that. And I want to say congratulations on receiving that grant. That's pretty
Thank
awesome.
you. It is okay.
Any,
Hold on. I
yes.
have the name. Bravely raising and activating voices for equity. Brave.
Ooh, wow.
Okay, go ahead. I'm
That's
sorry. I
it.
just had to redeem
All right.
myself.
Yes, yes. So, and that sounds like something you would do because you're brave and you're courageous. So, that sounds like the type of grant. I see why you're excited now. It's like your name is all over that one.
Oh,
So,
goodness.
I can see that. Well, this has been an amazing interview, and thank you so much for your time today. And we are looking forward to working with you in 2024. And anything that we can do to help, please let us know because we
Absolutely.
want to be proactive as we move forward. As you know, I'm in a period right now of beginning a new transition myself.
Yeah.
And so
Congratulations.
thank you. And
Congratulations.
so we will say like you, we appreciate the Lord for bringing us to this space, and we just trust him all the way. We just
Yeah.
trust him. So, all right, any would you like to share a website or phone number, anything? If people like to reach out to your organization, you're welcome to.
Well, I would say just Google us. We'll have more of a presence, the Racial Equity Collaborative, but that's our name, the Racial Equity Collaborative. And so you'll be able to find us online. Dr. Hill, thank you so much for having me. It's been such an extreme pleasure to chat with you today.
And thank you. It's been my pleasure to have you with us. And again, I like to say thank you to all who have listened to us on today. This is Shades in Justice. And I'm your host, Dr. Evelyn Hill. We've talked on this evening with the one and only dynamic, brave, courageous Shannell DuPree. And okay, you all, we see you next time at Shades in Justice podcast. Bye bye. Hey, thanks for being at our show on tonight. This is Dr. Evelyn Hill with Shades in Justice podcast. Another great evening to be alive. Hey, this is Positive Power Christian Radio. Dr. Evelyn Hill with Shades in Justice podcast. Hey, see you next time. You can meet me every Wednesday at 8:30 Central Standard Time or 9:30 Eastern Standard Time right here at Positive Power Christian Radio. See you next time. Bye.